Morning, class. We're going to go ahead and just kick off right where we were last time. We were talking a little bit about the different body systems and specifically the body cavities. These are very integral to maintaining health in the body. The body is designed to have different cavities so that way fluids, blood, organs, they don't interact with each other as much as they possibly could, right? So we have a cavity that surrounds the heart and lungs called the thoracic cavity. We have the diaphragm, and then just below that we have the abdominal and pelvic cavities. So we can kind of understand a little bit more about what kind of injury can occur depending on the type of cavity that has been affected. Let's get into some vital roles. Each body system, they all have vital roles for survival, right? The stomach, right? That's key purpose is to break down our foods so we can absorb them through our intestines. Our large intestines rid the rest of water out of them, and then in turn we rid ourselves of waste. Right? So it's good to know about where certain organs are located in the body. It'll help you to determine the cause, or not cause, but I should say the nature of the injury a little bit more. That way when you are talking maybe to 911, they can have a better understanding of what's going on, or if they aren't there for now, right, you can go ahead and maintain hopefully that person's current status at least, or maybe improve things. That's what our goal is here, always to do no further harm. Body systems, they're going to be working together to maintain constant health and a constant state of, you could say, well-being. And each body system really does depend on each other for survival in the long run. Now an injury, that can really impact how these systems interact and how they are going to then survive from there on forth. But what we have seen that if we have a progressive failure of body systems, this is going to lead to something called shock. Personally, I've been in a state of shock before, and I'll hopefully be able to describe some different types of injuries that could result in shock later on as we go. For now, though, I want to jump directly into checking an unconscious person. So if you can get to that portion in your booklet, your participant's manual, that's going to be a great place to start reading for this information. Again, checking an unconscious individual first. Later on, we'll get to a conscious individual. I know seems a little bit out of order, but it's a little bit more straightforward when we're checking an unconscious person because we're more likely going to be calling 911. So basic introduction, okay? I'm going to get to this over and over again, and it's going to be like I'm beating a dead horse, so to speak. So when we recognize an emergency, we're going to take the following emergency action steps. And this is going to go back to almost every single test. This is going to be your formula. The three items are check, call, and care. We check, we call, we care. And it's going to make the major difference for making sure that we can save a life in any emergency. So your decision to act is going to have a significant impact on a person's chances of survival. Straightforward. Life-threatening conditions are the ones, of course, that we want to be able to recognize right away and make that phone call, that 911 call. And these conditions would be considered things like somebody's unconscious, somebody's having very severe trouble breathing, or they're not even breathing at all. There could be severe bleeding. Those are all great examples of life-threatening conditions. Now, something you have to do always, right, when you approach somebody, you can't just go ahead and just grab them, right? Especially if they're unconscious, we don't want to jostle them. We don't want to cause any further harm to any kind of injury. And if they are conscious, right, we don't want to be putting our hands on people that didn't ask us for help. So the main thing is we start with the basic touch. We tap somebody on the shoulder and shout loudly, right, because maybe they were unconscious, right? You want to make sure they can hear you. It could just be passed out, for all you know, who knows, right? So we tap them on the shoulder. Hey, are you okay? Are you okay? Now for a child or an infant, okay, this is a great example, an infant. With an infant, we should gently tap the shoulder because again, they have a much smaller body size. If we tap them too hard, we could jostle them around too much. But the best thing to do is to flick the bottom of their foot. Flick the bottom of the baby's foot. That way, even though maybe a parent or guardian isn't around, maybe they see you from a distance, they see you doing proper procedure, you're flicking the baby's foot, and you're really taking care of that baby from the get-go. So they're less, maybe worried about who you are and your level of training. But of course, the second a parent or guardian comes on the scene with an infant or child, you want to let them know who you are as soon as possible, so that way it keeps the whole situation a little bit more calm and controlled. Big thing though, don't jostle, don't move somebody. Don't just go ahead and try to flip them over right away. We'll start with a tap on the shoulder, whether they're face down or face up. So face up, remember, was supine. Face down, prone. Now if the person is unconscious, right, we've determined now that the situation is considered urgent. The best thing you can always do is consider it could be a possible life-threatening condition and just call 911 right away. If you're alone, this is when you have to determine whether you call first or care first. And we've been through this a little bit already. We know that with cardiac emergencies, right, we want to go ahead and call and then care after. And with some breathing emergencies, we want to care and then call after. So let's take that scenario of a drowning incident. If somebody's drowning, we're not going to call 911 first. We're going to hopefully care first, right? This person needs to be safe from the water. This person needs, if they're unconscious, right, already, they're going to need rescue breaths. By delaying those rescue breaths, right, we're going to need 911 even more than after that. So we should care first in that situation, call after the first 2 minutes of care with breathing. And we'll get to that a little bit more here shortly. And then we also want to check for other life-threatening conditions along the way. We might be missing something. We might just see the superficial problem, but there could be other underlying problems going on as well. So we want to make sure we scan the entire body for other types of conditions. Now, there are some special circumstances, okay? For an unconscious adult, not breathing, or a known drowning or respiratory emergency, we're going to go ahead and give 2 rescue breaths right away. So what that means is after we've done a certain type of action, right? We've checked the scene for safety. We've checked the person. We tap the person. Are they okay? No response. This person's unconscious. We need to call 911, right? Then you start caring for that individual. Well, certain circumstances, right? You're going to come upon a scene where it's going to be very important to make sure you try to give 2 rescue breaths right away, because the likelihood of that condition could be because it is a breathing emergency first and foremost. And that might solve your problem a lot easier by doing the head tilt chin lift technique, plugging the nose, blowing air into their mouth, 1 second in, let it come out for a second, 1 second in, let it come out for a second. That might solve our problem right then and there. So if somebody's not breathing, or it's a known drowning or respiratory condition only, we go ahead and give 2 first rescue breaths. For all other situations, like CPR, when we need to perform CPR for a heart attack, there's no heart rate, for instance, that's a condition where we need to call first, because that person's going to need much, much more medical attention guaranteed after you giving them CPR while the EMTs are on their way. So another thing here. For a child or infant not breathing, who you witnessed collapse, do not give rescue breaths, okay? Just go ahead and start giving CPR and compressions. And again, like I said, don't give CPR until I've shown you how to do that. And we're going to have our time and whatnot to do that later on here with other videos and then with our other skills. But, okay, can you kind of understand what I'm saying here? Breathing emergencies, we want to give 2 breaths first. For cardiac emergencies, we want to give CPR first. Very straightforward. So if the heart's never not beating, that's CPR scenario. That's where we go ahead and give our compressions first, followed by the rescue breaths later on. And again, I'll show you that whole pattern of how we do those things once we get into the CPR portion. Now, you may also have a situation where you need to remove food or liquid or other objects that are blocking the airway and preventing the chest from rising during rescue breaths. Again, like I said, we're going to get into more of those things later on with how we give rescue breaths specifically, but it's always good to take a visual look inside somebody's mouth before you just go and put your mouth on their mouth, right? It's good to see what could be blocking airflow in their mouth, right? A little kid could be choking on something. If we open up the mouth and look inside, right, that's going to tell us a lot. If we see an object, right, we definitely don't want to try blowing air into their mouth, because that's only going to push that object further into their throat, and we're continuing that chance of, respiratory failure leading towards cardiac failure because they're not breathing, not circulating blood. Now, sometimes, right, you might be on a scene and somebody is unconscious and you must leave an unconscious breathing person alone to call for help, right? So they're unconscious, but they're breathing. Oh, good sign. If you're breathing, you have to have a heart rate. You can't just have the opposite come into play. So here I can show you right now, right? I'm alive. I'm looking at you. If I hold my breath, my heart is still beating, right? But if that delayed a long enough time, right? If I'm not breathing for a certain long enough time, that heart rate's going to stop altogether. So for now, we have a breathing emergency, right? If I'm not breathing and unconscious, but my heart rate's still going, breathing emergency. If we have no breathing and then we palpate maybe on the wrist or the neck or feel at the chest, right? And we notice no heart rate, right? That's another type of emergency altogether. No circulation's going on. So if we're not circulating blood, right, no organ systems are going to be working properly in that given moment. We need to perform CPR. Now, there are some alternative things we can always do, right? If we got to leave somebody alone. But the best thing we can always do is if we leave somebody alone, we're going to put them into that Haynes recovery position. Simply that's just laying them on their side, putting a hand underneath their face, kind of like they're laying like it's a pillow. And that way, if they're laying down on their side with their face down a little bit, if they do vomit or are choking on something then, or whatever it may be while they're alone, right, there's a less likelihood of the condition getting any worse. So what I'm trying to say is never leave somebody alone on their back the whole time if you have to go somewhere to get supplies or whatnot. Because again, they could choke on something while you're gone in that situation, and then the situation is just even worse. I'm going to play a little video here just to show you what it's like.
When you find a person who appears to be unconscious, follow the emergency action steps. Check, call, care. Check the scene for safety. For a child, obtain consent from a parent or guardian if present. Then check the person for responsiveness. If the person doesn't respond, call for help. If the person is face down, gently roll the person face up, keeping the head, neck, and back in a straight line so you can provide care. Once the person is on her back, open the airway by using the head tilt, chin lift technique. To perform the head tilt, chin lift technique, place one hand on the forehead and 2 fingers on the bony part of the chin. Then tilt the head back as you lift up on the chin. Maintain this position. For a child, do not tilt the head back as far as you would for an adult. Check for breathing for no more than 10 seconds. Look to see if the person's chest clearly rises and falls. Listen for escaping air from the mouth and nose. Feel for escaping air against the side of your face. Normal, effective breathing is quiet, regular, and effortless. In an unconscious adult, you may detect an irregular, gasping, or shallow breath. This is known as an agonal breath. Do not confuse this with effective breathing. Care for the person as if there is no breathing at all. If an adult is not breathing, quickly check for severe bleeding, then begin chest compressions. If a child is not breathing, give 2 rescue breaths, one after the other, before checking for bleeding and giving care for the conditions you find. Use a CPR breathing barrier if available. Tilt the head back and lift the chin up. Then pinch the nose shut and make a complete seal over the child's mouth. Blow gently for about 1 second. Each breath should make the chest clearly rise. If the chest does not rise, re-tilt the child's head and try another rescue breath. After 2 successful rescue breaths, quickly scan the body for severe bleeding and care for the conditions you find. If at any time an unconscious person begins vomiting, the airway could become blocked. Roll the person onto one side, and then use a finger to clear out the mouth. Once the mouth is clear, continue to provide care based on the conditions you find. If the person is unconscious but breathing, Maintain an open airway with the head tilt, chin lift technique, and monitor breathing and for any changes in condition until EMS personnel take over. If you cannot maintain an open and clear airway because of fluids or vomit, place the person in a modified Haynes recovery position by moving the person to her side while keeping the head, neck, and back in a straight line with the knees bent. If you need to leave the scene to call 911, modify this position by tucking the hand under the head.
There we go. Some of the basics of what we need to do when we're checking an unconscious individual. Now the big difference with an infant, right, is that we're going to flick the bottom of the foot and we're going to go, baby, baby, are you okay? Are you okay? Now we want to make sure we've gained consent always with these types of things with infants and children. So if the guardian's around, right, we got to ask if we can help and tell them our level of training. But if that parent or guardian is not around at all, we have to assume that they have given consent and want us to take care of their child. It's a big thing. And again, with an infant, right, those 2 rescue breaths, like they were saying before, same thing goes along as with the child, just like they were showing in the video. So children or infant, once we've go ahead and called, go ahead and give those first 2 breaths, check for those other conditions, and then continue with our CPR, for instance, if it's not breathing, not circulating blood combination. Jumping into a conscious individual, this makes a lot more sense, right? This is the thing where we get to get a lot more information from the person that's actually experiencing the problem, I guess you could say. So we're going to go ahead and proceed a lot differently with a person who's conscious and alert, right, versus somebody who's unconscious. If somebody's unconscious, we have to go right off the bat. This could be life-threatening. Let's call 911, get them on their way. If the person's conscious alert, now we need to determine exactly what caused the injury if we didn't see it, and what kind of injuries they've had, and how severe these injuries could be to where it could become or be a life-threatening condition. Always start by introducing yourself. Hi, I'm Kyle. You don't have to shake hands, right? But hi, I'm Kyle. I saw you just took a bad spill right now. I'm certified in first aid by the American Red Cross. May I help you? A lot of times, if somebody's very badly hurt, they're not going to mind somebody, especially who's trained, right? Since now they are aware you're trained, for you to help them, right? But if you just walk up there and start doing stuff, they're going to be very hesitant and very weirded out, I guess you could say. And, it's not going to make things any better in that situation. So always get consent. Always let them know who exactly you are. Very important. The first thing we always want to do when somebody's conscious is to check for some of those life-threatening conditions and then give care as needed. If there are no immediate life-threatening conditions, we can simply interview the person and the bystanders, right? For instance, a severe life-threatening condition would be a laceration wound in which it's affected an artery. And an artery, we'll learn about this a little bit more, is a blood vessel that pumps blood away from the heart that is oxygenated very forcefully to the top of the head, down to the tips of the toes. So it's very important that we can control bleeding in that situation right away. They can lose a lot of blood very quickly, and that can go from just a severe condition to a very life-threatening condition quickly. But again, go back, if there's no immediate danger, right, no immediate life-threatening conditions that you're seeing, we can interview the person, we can interview some bystanders if they saw it happen, we can check the person from head to toe. Now, with a child or with an infant, it's really best to go ahead and check that child or infant from the toes and work your way up to their head. Main thing is that they could possibly freak out a little bit more, right? If you start with their head and you find something wrong right away, that could lead to them being a little bit more scared of the situation. And that could make blood pressure rise even faster. It could make the situation much more difficult to handle. It could make the child very, very, very scared beyond belief. Now, some of the main things we want to do, okay, when we're checking a conscious person, we want to ask what happened, right? That's the first thing. What happened in this situation? We want to ask things like, where do you feel pain? Do you have discomfort anywhere? Do you have any allergies? That's a great question, because a lot of times there's a lot of allergic situations, even nowadays. with food allergies, with medications, with different plants, so on and so forth. Ask them if they are on any medications, right? Because you could have somebody with some chest pain going on and they're not just looking right. And if you ask them, hey, what kind of medications are you on then once you've introduced yourself and everything, and they say, oh, I take this blood pressure medication, or I take this one for my heart, or this one for this or that. Now it's kind of making more sense what kind of problem could have arose right now. Are you possibly having a heart attack then, you're thinking? And then next thing is, if the person does feel pain, ask them to describe exactly where it is, because you don't want to just go feeling around right away. You want to use very gentle touch, like you're touching, like you're holding on to like a baby chicken, right? Or an egg. You don't want an egg to break. And pain, different types of body parts can be extremely sensitive when they are severely injured. Take for instance, if you fall down and you bruise your elbow or something like that, every time you touch your elbow again, it does hurt a little bit, right? And it depends on how severe that injury is. So even a light touch can sometimes cause pain that is unmerited. So we want to be as gentle as possible from the get-go and ask questions first and foremost before we go touching on people. Ask them things like, what were you doing when this pain started or when this accident happened? Sometimes things like people could be gardening, right? And they could be working with pesticides or something, and they could be getting poisoned by it or something like that. And if they're conscious still, right, you can at least figure out what they were doing beforehand. This is me just making up scenarios as we go, right? There's so many hundreds of millions of different scenarios that could really happen in real life. And then ask them also for that pain aspect, where it is, ask them how severe it is. Everybody's got a different level of pain tolerance, but it's good to get that basic assessment, how painful is the nature of this injury. If the leg is broken, right, we don't know for sure because we're not a doctor if it's an internal break, but just by asking them how much pain they're feeling, that can tell you a lot about whether or not something could possibly be broken. We can't always see a deformity necessarily. And then if you go and write down this information. Maybe, there's a lot of information coming out from the person. The more you have for that EMT, the better off, because that person's situation, right, they could go unconscious, and at least you have that information written down and ready for those EMTs to take. Now, while you're checking a person that's conscious or unconscious, either or, just like we saw in the video from one of the first days of class where the gentleman was eating lunch and his face was down on the table and she saw that medical ID, right? We want to look for things like that. So let's get into this. There's a picture in your book that shows different types of medical ID tags, whether it looks like a watch or a bracelet. It could look like an anklet. It could look like just a regular necklace that somebody wears. But what you're going to see on is that it's got one of those snakes with the little staff, I guess you could say, along with it. And that's a telltale that somebody's got some kind of medical condition already. Sometimes it even says inscribed on that what condition it is. Diabetes, right? Could be a pacemaker. You really don't know. I mean, unless you actually look at that actual piece to determine what that person's condition already is. Not everybody wears those, though. We have to understand that. But it's another thing to help tell you what could be going on. When we're doing our initial head-to-toe check of an adult, okay, we don't want to move any areas of the body that cause discomfort or pain, or especially if they are a head, neck, or spinal cord injury. We never want to move somebody at all because we're only going to cause further harm than good. We want to check the head. We want to check the scalp, right? Because the hair can hide a lot with people. I've been experienced in this where I've seen head injuries and I think, okay, this is the only injury going on because I can see the blood coming from the scalp and right where it meets the hairline. But then when I palpate gently and feel around, I feel a bruise on the back, and then I look and there's blood in the back of the head too, showing that there's another injury that I just missed over almost completely. This happens a lot of times where we don't do enough survey initially to determine the full cause or full extent, you could say, of all injuries found. So do an overall check. It's very important. Of course, like I said, with a conscious person, this is a lot easier. With an unconscious person, we've already called 911, so we're doing these things as we go while we're waiting for EMTs to arrive. We're going to look for cuts. We're going to look for bruises, bumps, different kinds of depressions, right? This is all telltale of blunt force traumas or falls, spills, whatever it could be, injuries. We're going to watch for changes also in the person's level of consciousness, because if they are bleeding severely, right, they go from perfectly aware to passed out in no time. It depends on how much blood loss they've had, or maybe if organ systems are shutting down, they're going through a state of shock from a burn injury or a severely broken leg or an amputation. You know, these are situations that could go from really bad to even worse very quickly. So we want to go ahead and watch for their level of consciousness, right? We want to see if they're getting drowsy, if they're confused. A confused state person, right? You come upon the scene and they're just sitting up from an accident. Maybe they hit their head really hard, right? They sat up on their own. We've determined there's no head, neck, or spinal cord injury because they're moving their hands or something. Maybe we could come upon the scene like that. But still, they could be severely concussed, or there could be possible bleeding on the head, on the brain. This is where we want to have them sit back down or lie down, and we're going to wait for EMTs to arrive because you've been in a very serious situation and you're kind of in a state of shock from it all happened. And if you keep moving around, you're only going to make your injuries worse. I got a video I want to show you guys later on like broken bones and stuff like that, and how crazy some people can act in that situation when it does actually happen to them. And they do very awkward or weird things that you should never do, right, when you have a broken leg. Again, like I said, I'll show you that video some other time. Give you that link. Always look for changes in breathing. Always look at their skin. Skin tells a lot too about circulation. So if they're looking regular flesh colored to pale all of a sudden, oh, well, something really bad's going on. There could be an allergic reaction. There could be other things going on. Again, getting that information from the person is going to help us tell the tale a little bit more. Look over the entire body in general, right? Sometimes you got to look if they took a blunt force trauma to the abdomen region. Pull the shirt up, see if you see blood pooling underneath the surface of the skin. This is a telltale of internal bleeding going on. Always a bad condition. And then look for some things like I said, those medical identification tags. If signals of injury or illnesses are found for a conscious individual, we want to now determine whether or not to call 911 or a local emergency number. And then while we are waiting for the EMS, we do no further harm. We monitor the person's level of consciousness and breathing. We help the person rest in the very most comfortable position possible, whether that's seated in the Fowler's position, I guess you could say that is, where you're seated, legs are straight, seated upright, or laying flat on your back or on their side, right? Sometimes just leaving the position found, because if it's a head, neck, or spinal cord injury and they're fully conscious, right, we don't want to move them at all from that position that they're in currently. We'd rather maintain current stability of that position found. And we'll get into that later as we go into those things. Other things to do, keep people from getting overheated or overchilled. When organ systems are shutting down, the body can no longer control its core temperature. So we want to make sure that, somebody who's going through shock, they could be shaking violently, and they're shaking violently because they feel cold, right? We want to make sure they're not overchilled. And then vice versa with getting overheated. If it's a very hot day in the sunlight, whatever it may be, we want to keep it cool as possible. Not too cool, but you know what I mean. Cool, so that way they're not getting overheated and we're leading towards maybe a heat stroke or heat exhaustion kind of scenario then too. Just give a specific care as needed, but do no further harm. That's our key. Now check for shock. Okay, always look for signals of shock, and these are the signals you want to look for with shock. And I've been in shock before, so I can tell you all these are very, very true telltales. Number one is restless or irritable or a very altered level of consciousness. They could be hypersensitive to the situation, like freaking out, knowing exactly what's going on, almost to the point where it's like, whoa, I don't know why you're so intense right now. Like, you've just been through this traumatic injury. You need to relax at this moment. They sometimes need to be calmed down in the heat of the moment. Or sometimes the exact opposite could be happen. Their shock could be so intense that they're just almost passing out. Nausea and vomiting. These are good examples of initial signals of shock. Somebody that's very pale, excuse me, somebody who's very pale, they can almost look grayish in color, cool or moist skin. These are examples of possible leading towards shock. Extremely rapid breathing and short rapid breaths, another telltale. And the biggest one that I've noticed though overall is the excessive thirst. People who are going through shock are extremely thirsty at that given moment. The thing though to do is to never give anybody water. The key thing to do is to call 911 right away. Get the EMTs there. Refrain from giving somebody something to drink, because that state of shock, when you're trying to give them something to drink, could cause choking. And now you have another problem on your hands. Now, like I said, let's go back to children and infants. We need to get consent, especially when when there's a parent or guardian around. That's the time where we have to earn consent. So we ask the parent or guardian if we can help the child, let them know your level of training. You can also have the parent or guardian calm the child. If it doesn't look like a life-threatening condition like a head, neck, or spinal cord injury, let the parent hold the child. That's fine. It's going to comfort the child while you're checking for their injuries from their toes up to their head. Communicate clearly, really with the parent as well as the child, so they really know what you're going to do before you even do it. You really want to be thorough with your explanation, and then always get to the eye level of the child. By getting down to the eye level of the child, it's much easier to communicate then. It's really more easy to communicate with anybody when you make that good eye contact and get down to their level, especially if they've fallen down or got hurt or something like that. And then ask simple questions, right? A child, just use simple terminology. Don't go saying hard, weird things that they would never understand. Kids don't understand big words yet if they're 2, 3, 4, 5 years old. Keep it simple. Where does it hurt? What were you doing? What happened? Just keep it basic. Observe always before you touch, because again, if you just go grabbing, that could make the child even more hesitant to trusting you. Ask them and then be gentle. Maybe even start with the back of your gloved hand and touching them gently once they've said it's okay to, so that way they're not afraid that you're just going to grab them and hurt that injury that's currently going on. And like I said, always begin with the toes and work your way up to the head. Now, the exact opposite with an older adult. We want to start with the head and work our way down. But we also want to do the same things like we did with the child. We want to get down to their level if they fall down. We want to really let them know who we are even more. And we want to use their name over and over again, because it's a very nice thing. It seems like older people really like it when you use their name, let them know who you are. It really helps them trust you even more. So learn their name and use it. Place yourself at their level, eye level. Speak slowly, speak clearly. They could be hearing impaired. They could be mentally impaired for all you know. Don't treat them like they're special, right? But be respectful. That's the key thing here. And then find out if maybe the person could be confused. If they are, is this a result of the injury? Or is this a result of a condition already present? Very helpful in that situation. And of course, with older people, we need to find out things like medical conditions or medications that they could be taking that can help us out a lot with that current situation. And I think that's a good place to stop. So we covered information, basics for checking an unconscious individual and checking a conscious individual. We always go back to our training. We check, we call, we care. We check the scene for safety, we check the person. Are you okay? No response, we call 911. Okay? Person's conscious, we tell them who we are. Child, we get consent from the parent or guardian. If no guardian around, we assume consent. We help the child. So check the scene, check the person. Call 911, care for conditions found. Always go back to these 3 C's. Check, call, care. And with any test question, it's going to lead you straight to the answer every single time, as long as you read it thoroughly and know exactly what step the action plan we are currently at. Now, this is going to be about the point where we're at our place where we're going to have our first exam, okay? And just to let you know, our exams are 20 questions for this first one. Multiple choice, all right? So all you're going to do is I'm going to submit this to Blackboard. I'm going to need you to answer the questions. You can send it to me by email. That's the best way to do this. Whether you want to do it on a Word document or just directly in the email itself, it's fine by me. But just number it 1 through 20, and then just write the letter next to it in that email or that attachment with the email. And again, my email is lowercase fog0845@yahoo.com. The very best way to send me every single one of your assignments, so I give you your correct grade as soon as possible. One last question, just because I know it's on the tests and we don't really go over it too thoroughly yet, but it's kind of like, what's going on in the COVID right now. How long do we wash our hands for? We've heard of the 60, 20, 100 rule already right now, I think by now. 6 feet, 20 seconds, 100. But the main thing here is what we're talking about is the 20 number. The 20 number is 20 seconds for how long do we wash our hands, right? 100 goes with the temperature of your body. We're not worried about that here in this whole thing right here, but I'm worried about this test question. How long do we wash our hands for? A minimum of 20 seconds. We want to make sure that we've killed any bacteria off our hands, that water's cleansed our hands, and that way we're going to eliminate any chance of exposure to anything to this person's injury. But first and foremost, we always have these gloves, so if there's not hand washing available, put these on right away. If we have the opportunity to wash our hands first and then put these on, awesome, even better. Thank you so much. No assignments, but I will be posting the exam later on this week, and new information as well after that. The exam I'll leave open for a total of 48 hours, so you have plenty of ample time to get on the Blackboard, open it up, and then send that to me with your answers via email again. Any questions, text me. That's the best way to get a hold of me other than by email. Thank you so much, and have a great week.